Today we're going to talk about treatment options for COVID-19 for those who have arthritis and other rheumatic conditions. As always, we caution you that this information is based on the knowledge available when we posted this video, which was April of 2022. Check back here for updated videos, or much more commonly on our website where we update the information as it becomes available. The other thing we want to remind you is that while we're talking about treatments for COVID-19, the vaccines remain our most effective tool at reducing the risk of severe COVID-19 infection, including the need for hospitalization. And they can be used safely for those who have rheumatic diseases and those who are receiving medications that influence the immune system. And for more information on COVID-19 for those who have arthritis, please watch our other videos or again, visit our website. But here, what we want to talk about are the available treatments besides vaccine for COVID-19 for those who have arthritis rheumatic disease. And specifically, we're talking about treatments for those who are not being hospitalized. Hospitalized patients, there are other options that are available, but here we're trying to prevent really bad COVID, those who need to be hospitalized and need significant support and treatment. So right now there are two medications that are available. There's Cetravamab, which is an intravenous or an infused medication given through an IV directly into the blood. And there's Paxalvid, which is a medication given by mouth through pills. And we'll talk about both of them. So Cetravamab is a monoclonal antibody treatment. Monoclonal antibodies are similar to other medications that we often use, biologics that we use in rheumatology, so not unheard of in our population. It's approved for those who are 12 years of age and older with mild to moderate symptoms of COVID-19. And how it works is that it binds the spike protein of the coronavirus, the virus that causes COVID-19, and thereby neutralizing the virus. In Alberta, it was the first treatment available to be offered for those not in hospital, but who are at high risk of needing hospital for COVID-19. And it should be administered as a one-time intravenous infusion within 5 days of symptom onset. And that time frame is really important in terms of how effective it is. And it's been shown to be about 80% effective, which is pretty good, to reduce hospitalization for those who have an active COVID-19 infection. It is currently available for those who do have inflammatory conditions such as rheumatoid arthritis, lupus, vasculitis, really any rheumatic disease, but who are also receiving systemic immunosuppressive or immunomodulating treatment, and regardless of their vaccine status. And we've listed here essentially all the medications that would qualify someone for receiving Cetravamab. Really, the only one in rheumatology that doesn't count would be Plaquenil or hydroxychloroquine, although the vast majority of our patients who are on hydroxychloroquine are also on one of these medications as well. If you're not sure, of course, check with your rheumatologist. The other medication, the one that you take by mouth, is called Paxalvid. Paxalvid actually contains two medications in the pill. One which stops the virus from multiplying, and the other one which serves to increase the drug level in the body of the first one to make it more effective. Again, this was the second treatment that was available, particularly in Alberta, for mild to moderate COVID-19 in the community, meaning those who are not in hospital, but who are at high risk of hospitalization. Paxalvid was shown to be about 88% effective to reduce hospitalization and death from COVID-19. And what's perhaps more impressive, those who were enrolled in the trial to show this were not previously vaccinated and did have risk factors for severe disease, including the use of medications that affect the immune system. So for those who are vaccinated, potentially it might be more effective, although that might be a bit of a stretch to say that with certainty, and we'll have to see more studies as they come along. Similar to Cetravamab, this treatment may be offered to patients with confirmed diagnosis of COVID-19 with symptoms for less than 5 days important to note again. The dose is 3 tablets by mouth twice daily for 5 days, and it's really important to take the full course of 5 days. And there's some mild common side effects that one can see with Paxalvid, including change in taste, diarrhea, muscle aches, headache, or potentially an increase in blood pressure. Perhaps most importantly, it does have to be used cautiously or may not be used at all depending on one's kidney function. And it has some significant drug interactions, including for a number of medications that patients who have rheumatic disease may be taking. So the category of medications called JAK kinase inhibitors, which includes tofacitinib, Xeljanz, baricitinib, Olumiant, and upadacitinib, which is Rinvoq, as well as apremilast, cyclosporin, and colchicine used often to treat gout, but some for other autoinflammatory conditions for rheumatic disease. So it's really important that you share with the person who may be prescribing the Paxalvid for you what medications you are on, both prescription and non-prescription. Now, of note, for those who have rheumatic disease, we generally recommend that you stop your medication for your underlying inflammatory condition if you have COVID-19. This would be no different in this situation, which means that you would still be able to take Paxalvid safely because you'd be stopping any of these medications at that time. Please ensure that whoever is providing the Paxalvid does not feel these medications don't allow you to take Paxalvid, because again, you would stop these medications so you can safely take Paxalvid. If you have COVID-19 and you are eligible for these treatments, which again, anyone with a rheumatic inflammatory condition who is on essentially any of our medications should be eligible. And if you had symptoms for essentially 4 days or less, please call HealthLink. We have the numbers posted here, but also on our website. Check with your rheumatologist if you're not sure. These treatments can be critical to ensure you do not get severe COVID infection. For more information, please always remember, check our website at albertarheumatology.com.